What is first aid? First aid is medical care that is usually given right after an injury occurs and at the site of the damage. It's usually a one-time, short-term treatment that doesn't involve any equipment or experience. It refers to the emergency or immediate care that people should provide when a person is injured or ill until full medical treatment is available. What is the importance of first aid? First aid has the potential to save lives that makes it important and vital. When it comes to more serious injuries, first aid prevents the injury to become worse. In some situations, if a patient doesn't receive any basic first aid care immediately, their situation will deteriorate and can cause critical situation. By being able to provide basic care and first aid, you can stabilize a patient until emergency medical services and professional or expert arrives.
How to do DRSABCD. Each of the letter is a stage in the process, either an assessment the first aid provider needs to make or a task they need to perform. The different steps are as follows. First is danger. The first steps in the procedure is to determine whether or not there is any threat. In many emergency situations, something in the surrounding may have caused the sick or injured individual to become a casualty. Yet, the threat remains. Live electricity, a fire, chemicals, falling large objects, or a harmful animal such as snake or dog are all possibilities. The first step is to eliminate the threat or move away the person from it. Next is response. The second step is to check the person's responsiveness. Do they respond to your voice, and are they able to answer? There is a big difference between first aid for a responsive, aware person and an unconscious one. This step often has its own mini-steps, including its own acronym to remember, such as COWS. COWS for Can you hear me? Open your eyes. What is your name? And squeeze my hand. Next is send for help. It's time to contact for aid once you've made sure the place is safe and determine whether the person is conscious or responsive. If you're alone, this could involve finding someone to contact 911 for you or making the call yourself. You can leave the phone on speaker mode while you continue to provide first aid. The 911 operators will be able to provide you with advice while help arrives. If you don't have access to a phone, you might have to shout for help. In the worst case scenario, if no one is nearby, you may have no choice except to roll the individual onto their side. Next is airway. Open the person's mouth and check for the foreign materials, such as bits of foods or fluids, such as vomit. If there's anything there, roll the person onto their side to allow fluids to drain out. If you can be confident of not making the problem worse, scoop any blockage out with a finger sweep. Use gloves if possible. If their airway is clear, make sure they're lying on their back, and then tilt their head gently back to open up the airway. Next is breathing. Check to see if the person is breathing. Keep an eye out for the chest rising and falling. You can also feel for this. Also, for at least 10 seconds, listen for the sound of their breath near their mouth. Put them in the recovery posture if they're breathing on their side. If not, double check that 911 has been dialed and begin CPR. Next is continue care. Follow instruction from 911 on, or continue treatment until an ambulance arrives. Next is disability. Disability assessment, deadly bleeding, or automated external defibrillator, or AED, which is a device that shocks the heart so it begins beating. Next is examination. Evaluating the person for signs of injury, bleeding, allergies, or other problems once you know they're breathing and their heart is beating.
DRSABCDE stands for D. Danger. The first step in the procedure is to determine whether or not there is any threat. R for response. The second step is to check the person's responsiveness. S for send help. It's time to contact your aide once you've made sure the place is safe and determine whether the person is conscious or responsive. A for airway. Opens the person's mouth and check for foreign material, such as bits of foods or fluids, such as vomit. B for breathing. Check to see if the person is breathing. Keep an eye out for the chest rising and falling. C for circulation. Continue to care. Follow instructions for 911 on or continue treatment until an ambulance arrives. D for disability. Disability assessment, deadly breathing, or automated external defibrillator or AED, which is a device that shocks the heart so it begins beating. And E for examination. Evaluating the persons for signs of injury, bleeding, allergies, or other problems once you know they're breathing and their heart is beating.
Cardiopulmonary resuscitation or CPR is a life-saving procedure that combines chest compression with artificial ventilation to maintain brain function until further measures are done to restore spontaneous blood circulation and breathing in person who has gone into cardiac arrest.
A. Check that the area is safe for you and your patient and don appropriate PPE. B. Check for alertness or responsiveness with the top of the shoulder. C. Activate or direct someone to activate 911 or call ALS backup as appropriate. Also, if not already available, bring or have someone an AED to the patient's side. D. Place the person on their back on a hard surface. E. Open the patient's airway with a head tilt to slightly lift the chin. F. Simultaneously assess for carotid pulse in adults, brachial pulse in children and infants, and breathing for no more than 10 seconds. G. If patient is unresponsive and is not breathing or has abnormal breathing, example agonal breathing, and no definite pulse was, immediately begin chest compressions for at least 2 inches in depth. 1/3 the anterior posterior depth of the chest in children or infants at a rate of 100 to 120 compressions per minute, allowing for full chest recoil. H. After performing 30 compressions, administer 2 rescue breaths via VVM, mouth-to-mouth, mouth-to-mask, or through stomach as appropriate. For children and infants, if there are 2 rescuers performing CPR, the ratio of compressions to ventilations changes to 15/2. I. After the 2 rescue breaths have been administered, immediately resume chest compressions. J. Repeat the cycle of 30 chest compressions and 2 rescue breaths and use the AED or defibrillator as soon as it is available. Continue CPR until properly relieved by secure personnel.
What are the various types of open wounds? First is laceration. Is a cut that tears the skin and may also involve damage to the underlying tissues. Unlike an abrasion, none of the skin is missing. Blunt trauma is a usual cause of laceration wounds. Deep or long laceration may require stitches by a physician. Seek an evaluation by a doctor right away if you have a cut that continues to bleed, because medical treatment is necessary. The first step is to stop the flow of blood by applying firm pressure to the laceration with a clean cloth or gauze. Second, a small amount of blood is advantageous in cleansing the wound, but a large amount of blood loss can be dangerous. Third, properly clean the wound. Remove all dirt and debris by first running cool water over the area, and then clean with a sterilized cloth, warm water, and mild soap. Apply antibiotic ointment and then cover the wound area with a sterilized gauze, bandage, and first aid tape. Fifth, clean the wound area daily with soap and water and apply a fresh sterilized bandage. And lastly, for a minor laceration, remove the bandage after a couple of days to promote healing.
Puncture. A puncture is a hole in your skin that usually goes through all layers of the skin. It often results from mishandling or stepping on pointed objects, such as needles and nails. A bite from an animal may also be considered a puncture wound. Go to an urgent care center right away if you suffer a puncture wound of any kind. Metal exposure and animal bites pose an exceptionally high risk to your health. Metal tends to be dirty or rusty, and animal bites deliver bacteria or viruses from the animal's mouth directly into your body. This can cause a serious infection. A puncture wound, such as from stepping on a nail, doesn't usually cause much bleeding, but these wounds are often deep and can be dangerous because of the risk of infection. First, wash your hands. This helps prevent infection. Second, stop the bleeding. Apply gentle pressure with a clean bandage or a cloth. Third, clean the wound. Rinse the wound with clear water for 5 to 10 minutes. If dirt or debris remains in the wound, use a washcloth to gently scrub it off. See a doctor if you can't remove all the dirt or the debris. Apply an antibiotic. Apply a thin layer of an antibiotic cream or ointment. For the first 2 days, rewash the area and reapply the antibiotic when you change the dressing. 5. Certain ingredients in some ointments can cause a mild rash in some people. If a rash appears, stop using the product and seek medical care. Cover the wound. Bandages help keep the wound clean. 6. Change the dressing. Do this daily or whenever the bandage becomes wet or dirty.
Burns are caused by overexposure to thermal, electrical, radiation, laser, or chemical agents. You can treat minor burns at home, but a non-minor burns wound requires immediate medical attention. Burn wounds can be classified based on the extent of the injury. First-degree burn affect only epidermis and may cause redness and pain. Second-degree burns affect the epidermis and the dermis and may cause blisters. Third-degree burns reach into the fatty layer under the skin and may destroy nerves.
For minor burns, cool the burn. Hold the area under cool, not cold, running water for about 10 minutes. If the burn is on the face, apply a cool, wet cloth until the pain eases. After the burn is cooled, apply a lotion, such as one with aloe vera or cocoa butter. This helps prevent drying and provides relief. Next is bandage the burn. Cover the burn with a clean bandage. Wrap it loosely to avoid putting pressure on burned skin. Bandaging keeps an air off the area, reducing pain and protects blistered skin. If needed, take a non-prescription pain reliever such as ibuprofen, Advil, Motrin IV, and others. The four types of open wounds are the avulsion, also known as a skin tear. An avulsion is a deep break to the skin, tearing it away from the underlying tissue. Wounds of this type are usually more serious and extensive. Traffic accidents and machine injuries are among the common causes of skin avulsions. When an avulsion affects a large area of the skin, doctors usually consider skin grafting as part of the treatment and reconstruction process.
What are the basic steps for wound care? First, wash your hands. Cleaning a wound with dirty hands increases the risk of infection. Even if your hands appear clean, before doing anything to a wound, wash your hands thoroughly with soap. Rub your hands under water for at least 20 seconds and use soap to remove germs and bacteria that may cause infection in a wound. Second, stop the bleeding. The next step is to stop bleeding from the wound. You should do this by applying pressure to the wound and allow the blood to clot. Make sure to use a clean cloth or bandage when applying pressure to the wound. Also, raise the body part that has suffered the wound. Gravity will help keep blood from rushing to the wound site, which will help stop the bleeding. Number 3. Wash the wound. Once the bleeding stops, it's the best to clean the wound with running water. Be gentle while you clean it. You may notice a stinging sensation, pain, and some slight bleeding when you clean it, and this is normal. Fourth, dry the wound with a clean cloth. 5. Apply antibiotics. Next, apply antibiotic ointment to the wound. The antibiotic will prevent the growth of bacteria that may lead to an infection. A thin layer of cetirizine antibiotic ointment is enough. Sixth, cover the wound. Use sterile dressing to cover the wound. The goal is to protect the wound from outside elements as it heals. If the wound is minor, you don't have to cover it with sterile dressing, and a simple bandage will do. However, for moderate-sized wounds, it's best to cover with sterile dressing and tape. Do not tighten the dressing too much or to keep it too loose. It should fit well over the wound so it doesn't slip off, but should not cut off the circulation of the blood to the area either.